Here, we will review the progression of SIRS to septic shock. Please note that while clinically SIRS is falling out of favor, it is still a highly tested topic on examinations. Therefore, for completion's sake, I will review SIRS criteria as well. With that being said, let's get started. Systemic inflammatory response syndrome, also known as SIRS, is outlined below as follows. And basically what it means is that you need a temperature greater than 38 Celsius or 100.4 or less than 36 degrees Celsius, which is the equivalent of 96.8 Fahrenheit, a respiratory rate of 20, greater than 20, a PaCO2 of less than 32, a pulse or a heart rate greater than 90, and then a shift in the white blood cell count, either greater than 12,000, less than 4,000, or greater than 10% bands. So basically, in order for you to have SIRS, you need two of the following variables or criteria. Okay? Let's talk a little bit about sepsis. It's basically when you transition from SIRS, 2 or more, plus a confirmed or suspected infection, then that means you no longer have SIRS, you have sepsis. So it's very straightforward. If a patient came in with dysuria, temperature of 39 Celsius, and a heart rate of 112, and a positive urinalysis, this patient would qualify as being septic. Now, if, for example, this patient was in the ER and the ER is swamped and the UA reflex, the culture, and all that is still pending, but you recognize that she has 2 of the above objective findings and complains of dysuria, you have a high suspicion that her source of infection is GU in origin. So this patient would also still qualify as having sepsis. So my clinical pearl for when a patient has sepsis is that you can use something called the SOFA score, and it's basically a predictive score for organ dysfunction. It does not diagnose sepsis. It rather just highlights that this patient has a high risk of dying from just overt infection. So you can use a SOFA score in your evaluation of sepsis and severe sepsis, and it'll give you an indication of whether or not this patient is at high risk for dying of sepsis, but it does not tell you whether or not the patient has sepsis, okay? So you use the SIRS criteria, and if you have a suspected source or a confirmed source, then the patient is septic. So what happens when we move from sepsis to severe sepsis? What does that mean? Well, that basically means that you're going to have sepsis with greater than one organ system having dysfunction. So an example of that would be, a patient's hypotensive. They have a systolic less than 90, for example, or they have altered mental status, oligouria, or lactate greater than 4. These are all signs and indications that there's an organ system with dysfunction. So sepsis with one of the above that I just stated means that the patient has severe sepsis. Septic shock is when a patient has severe sepsis, and despite the resuscitative fluid attempts, your patient is refractory to the treatment and they remain hypotensive. So that's pretty much it. So just to recap, we defined SIRS, sepsis, severe sepsis, and septic shock. We touched on a few clinical examples, suspected UTI versus confirmed UTI. We correlated the SOFA score and its usefulness in clinical practice and highlighted that despite ample fluid administration, patients with septic shock are refractory to IV fluid administration and resuscitative efforts. So that's pretty much it for this video. Thank you so much for your time, and happy studying.